Welcome to Medicaid Matters, the only live talk show about the business of Medicaid health care. And now, here's the host of Medicaid Matters, Richard Yaden.
And thank you, Braley, and welcome to the Tuesday, November 27th, 2012 edition of Medicaid Matters. I am your host, Richard Yaden, and I believe I'm probably sounding a whole lot worse than I actually feel, dealing with a little bit of upper respiratory virus today. So hang with me. Probably not the best thing to happen if you're doing a talk show, but we're going to make it through today. We're coming to you live from the MMS studios in Brentwood, Tennessee, and we're really glad that you're here with us today. This is the only live and interactive talk show about the business of Medicaid health care. And over the next hour, we're going to be talking about a couple of things. First of all, I'm going to be talking with the 2012 Managed Care Nurse Leader of the Year, Lanita Kanoki. I had a very interesting conversation with her yesterday, and we're going to hear some of that. And then we're going to take a look at one of the hottest, one of the fastest growing topics in healthcare right now, accountable care organizations, and just what's happening with ACOs today and how that might be a impact on the Medicaid healthcare as well. And also, just for those of you who are listening, we are looking for some experts, ACO experts, to be on our show in the next coming months. And if you have an interest in doing that and have some expertise, we'd like you to get in touch with us. You can do it right there at the MedicaidTalk.com webpage. There's a link for anyone interested in being a guest on the show. If you'll take a moment, click on that link and fill out some information, and then we'll be in touch with you. Well, quite a week we've had. We've just finished Thanksgiving. We've been through Black Friday, then Cyber Monday. Notre Dame is still number one in football. Unfortunately, the Titans here in Nashville fired their offensive coordinator yesterday. We even have the Republicans talking about raising taxes, and we have the Democrats talking about budget cuts. So, boy, a lot has transpired in the last 2 weeks since our show. And I'm almost 100% sure that with all that's going on right now, you have an opinion or a comment about some of it. And guess what? We'd like to hear what you have to say. This is one of the reasons we're here, to be a forum for your ideas, for your experiences, to be a forum for your thoughts and your comments. And that's what Medicaid Matters is all about. So we're ready for your calls now. If you'd like to join us on the air during our show today, the number is 626-657-2125. That's 626-657-2125. You can speak with me during the show to comment on anything that I'm talking about. We really want to hear your opinions and your comments about our subjects today. If you can't call for whatever reason, but maybe you're listening or watching on your smartphone, you can also reach us on Twitter. You can send us a comment or a question to @Medicaid Talk. We'll get them on the air as they come in. Those are being monitored during the show as well. Well, last week, one of the things I spoke with you about was, or actually mentioned to you, that I had been invited to be the chair of the Medicaid Innovations Conference, which is going to be in Orlando this coming February. I believe it's February 6th through the 7th. If you go to MedicaidTalk.com, you're going to see a link to the conference where you can get all the details about this event. Now, we were at, our show was at the conference last year in Orlando. We had a great time while we were there. I was really impressed with the caliber of presentations. We did a live broadcast of a panel discussion, and if you want to see something like that, you can go through our archive broadcast and you can catch that if you missed it. But what I want you to learn from that panel discussion, as well as the content that's in that, is the quality of presentations that are at the Medicaid Innovations Conference, and they are as good, if not better, slated for the agenda for the 2013 conference. The Affordable Care Act is moving forward, and it's likely that we're going to see an expansion in Medicaid for several years to come. And there's no question that managing this is going to be a real issue. It's going to take a new way of thinking. It's going to take new ideas. It's going to take new processes. And that's exactly what you're going to get at the Medicaid Innovations Conference. And that's exactly why you need to be attending there. If you want to hear the latest, if you want to hear about all the greatest and newest innovations that are coming out in the business of Medicaid healthcare, then you need to come and join me. Be a part of the conference this coming February in Orlando. Now, I've also told you that our listeners, you will receive a $200 discount to go to the conference. Just register to get our show updates, and I believe the discount code is also on our webpage at medicaidtalk.com. It's right there in the upper right-hand corner of the page. Put your email address in. You're going to get all the updates about the show, but you're also going to get the code for a $200 discounts on the conference. I don't think it could be really any easier than that for you to be involved with this. So I hope I see you there. We're going to do a live broadcast while we're there. We've done a number of conferences. It's always great to get to personally meet our viewers, our listeners to the show. You've given us great feedback and direction on the show. We appreciate it very much, and we hope that that you can continue to do that by being at that conference. Well, last month I had the honor of presenting the Managed Care Nurse Leader of the Year Award at the Managed Care Forum in Las Vegas. It's an annual award that's given to the managed care nurse. It's given to a managed care nurse by the American Association of Managed Care Nursing. And since 2007, the association's Leadership Institute has selected the managed care nurse who most demonstrates dedication to managed care nursing, leadership in one's organization, leadership within the community, and personal achievement in the field of nursing. And that's exactly, when you think about it, the kind of leader that we're going to need that's going to be able to meet the challenges that are in store for managed care as well as Medicaid. This year's award was given to Lenita Kanoki, and Lenita is certainly no stranger to managed care nursing. Currently, she works as a medical review manager for IntegraGuard. She's been a registered nurse for over 29 years in healthcare, and 16 years of that has been in management experience. She has a BS in business management. She's also a certified managed care nurse and a certified instructor in the InterQuals. Now, Lenita wanted to be here with us live on the show, but she wasn't able to make it. I did have a chance to speak with her yesterday about this award and about some of the trends and some of the issues she's seeing today in managed care nursing. She also has a leadership position in the association, so she gets a broad spectrum of insight into what's going on in managed care nursing, particularly in the areas of care management, care coordination. Here's what she had to say about the award and about what's going on in managed care nursing.
Let's get started. Lenita, tell me just a little bit about your background and how you got involved in managed care nursing.
Well, I've actually been involved in managed care since 1990. At that time, I went to work for a company called Mutual of Omaha as a medical review nurse. Just kind of worked my way through since that time. So I've actually had the opportunity to touch almost every aspect of managed care as it's come into fruition over the years. Through that, go ahead.
I was going to say our audience, is very involved in Medicaid. Can you maybe talk to your experience or any involvement you've had with Medicaid?
Sure. My initial experience with Medicaid, managed care Medicaid, would have been at Mutual of Omaha. We were actually one of the first in Nebraska to implement managed Medicaid in an HMO environment. So it was quite interesting because that was back when it was new, and lots of changes since then. Then as I moved on in my career, I also had the opportunity when I worked with a company called Ancillary Care Management. We worked with United Healthcare with all their ancillary services, and we did both the commercial and the Medicaid portion of that for them, doing all their medical review for the ancillary services, which there's been a lot of changes between the Mutual of Omaha days and the ACM days.
Yeah, no question, no question. Well, congratulations on being named the Managed Care Nurse Leader of the Year, which was an award that I got to present to you a few weeks ago in Las Vegas at the Managed Care Forum. Could you tell us a little bit about this award? And I know you've been involved with this for quite some time.
I have been. I was actually the first director of the Leadership Institute for AAMCN. We wanted to find a way to encourage leadership, encourage people to move forward in their careers, something that we find very lacking in nurses. So that was the starting point for the Managed Care Nurse Leader of the Year Award. Mm-hmm. At that time, we worked together to come up with criteria of what a leader is, trying to really hit on, what makes a leader, not just a nursing leader, but any type of a leader. And from there, we took nominations for anyone who felt, whether they were part of the association or not, that they felt that someone who has made a difference in the managed care nursing throughout the United States.
Mm-hmm. Now, for some of our listeners who may not be familiar, could you maybe explain a little bit about the AAMCN, what that is, and some of the work it does?
Sure. AAMCN is the American Association of Managed Care Nurses. It is a national group we're nationwide. We do not do individual by state, but we are a nationwide group that work in conjunction with a couple other associations to promote managed care nursing and to be a support element for those that are involved in managed care nursing.
Yeah, and I can certainly attest to the work that the association does. We've been involved for several years as well, and I just have nothing but great things to say about the leadership team there, the support staff, and I would certainly encourage any nurses that are at all involved with managed care to check it out. How would they get in touch with the organization?
A couple different ways. It's aamcn.org is the URL. You can also contact them by calling. Jennifer Turner is our coordinator, and I can actually look up her number here, and the number would be 804-747-9698.
Great. What are some of the benefits you think a nurse would receive from being a part of the association?
I think that, as with all associations, you get more by being more involved. There are multiple groups that we have. We have the leadership group. So these are all like committees. Mm-hmm. So we have a leadership committee. We have a educational committee. We have developed standards. There's just multiple of those type things that we can involve staff, other people who are interested in. Mm-hmm. We have a certification program for managed care nurses, which is your CMCN, which pretty much covers anything that you would do in the medical review realm of the nursing. It covers quality, it covers management, mm-hmm. the managed care. And when we speak managed care, of course, we're speaking both commercial, Medicaid, and Medicare. So whether it's a federal program or a more commercialized program. There is 2 conferences a year mm-hmm. that as a member, you actually get complimentary admission to one of those, which is a wonderful networking opportunity, plus the educational components of the CEUs from those.
Mm-hmm. Yeah, I have also been at those conferences, and you are right. The networking is great, and the quality of information and presentations is just outstanding. I would certainly encourage anyone who is considering it to be a part of it.
I would agree.
You have obviously spent some time in managed care, certainly working in managed care, but also your involvement in the leadership committee at AAMCN. What are some of the trends that you're seeing developing right now across managed care that you think nurses need to be aware of?
The interesting thing I believe right now in managed care is whereas through the years, we've always had managed Medicaid since the late 90s, but we've seen a lot of the commercial drop off and go in different directions. What I really noticed more and more recently is how it's coming back into that fruition. They may call it something else, but it's still a managed health care of some form. You see a lot of it with dual eligibles that are dual eligibles for Medicare and Medicaid. A lot, especially when they're complex healthcare needs, which obviously that would be a dual eligible. I think, too, they're just enhancing the way that they, when everyone thinks of managed Medicaid, they're thinking someone's managing their care too much. But I think that the way they're changing the primary care piece of it, so it's more of a case management aspect where you're giving them the basic care and coordinating that care and authorizing additional needs, but still having that medical home, so to speak, where one person is really controlling, this is what's going on with this patient and this is what they need. It's more of a case management type versus just what everybody referred to previously as just a referral to the.
Well, we're going to take just a short break here for our sponsors. When we come back, we're going to finish our conversation with Lenita. She's going to talk more about what's going on in managed care nursing and her observations. And we also don't want to miss the lightning round with Anita as well. Be right back.
By providing access to the care they need and the quality they deserve, Medicaid health plans enhance health outcomes of our nation's underserved. Listen to this letter to a Medicaid health plan that helped save the life of Juan, a 4-year-old with a rare heart disease.
All of your efforts have created a miracle for my son. Even though he was so close to death, you helped. You made a difference. Now he's coming along, little by little, step by step.
Medicaid Health Plans of America, ensuring access to better health care. Learn more at mhpa.org.
And welcome back. This is a short break we want to take because we don't want to miss what Lenita has to say. But welcome back. We are the only live and interactive talk show about the business of Medicaid health care. If you're at the MedicaidTalk.com page, you'll see up there in the upper right-hand corner a place to put your email address in. That's how you're going to get all the information about what's going on with our show, upcoming guests, schedules. We do send out special things for our listeners that are part of that. So take a minute now and get on the list. Be sure that you're getting all the information you need about the show. And let's get back to Lenita and what she was talking about.
This doctor referral to that one. So actually, I think it's a great trend. I think managed care certainly has a place. I think it can very much decrease cost of medical care once it's applied correctly.
Yeah. We're seeing among our clients a lot of integration in their care coordination programs with community-based resources. Are you seeing this as well across the spectrum?
I do see that. I do. And I think the more that they can manage, I mean, that whole core of that care coordination, the more that one medical home can really, which is probably not even the right word for it, but that one office that has multiple services can really help get them through all the other services that they need and that can keep them healthy, or that can keep the preventative pieces completed so that there's less other issues, less illness, less avoidable illnesses.
You are very well networked and connected as a function of your positions within the association and that. What do you see nurses doing in your member organizations what do you see their organizations doing to prepare for some of the upcoming Affordable Care Act, mandated changes? I mean, there's going to be a lot of change in the next several years in healthcare, perhaps more than we've seen in a long, long time. What do you see your nurses doing to get prepared for that?
Mostly, I think right now what you see is the educational components, learning more about what this new healthcare environment is going to look like. What are the needs? How can we take care of our patients? Because our patients, no matter what aspect of nursing you're in, your patients are still your most important and your primary focused.
Mm-hmm.
So I think what I see most of the nurses that I know and that I network with, both in my organization and other ones that I'm associated with, is learning as much as they can about how that's going to impact their position and what they can do to make sure that all the elements are still happening that needs to happen for those patients and to keep wellness alive within those communities.
Now, I don't want you to give away any trade secrets, but what are some of the maybe related projects that you might be involved with at IntegraGuard right now?
Because of what we do at IntegraGuard, it's a little bit different. We do medical review, but we do medical review for benefit integrity. So we look at the Medicare population and the federal entitlement programs and making sure that those patients have received what they need. So the new healthcare things don't affect us as much because we're looking at things after the fact or as they're happening. But again, I would still say we continually educate our nurses on how we can impact that and how what we do impacts every piece of the healthcare field.
You know, we talk with a lot of nurses in the work that we do who want to get out of the hospital field and want to get into managed care, particularly in managed care case management. And sometimes this is very hard for a nurse to do that doesn't have managed care experience. How would you advise them to go about making the transition from maybe hospital-based case management into managed care or health plan-based case management?
I think the first thing you have to do once you've made the decision that you want to go into that role is to get all the information you can about what that role is, what's available in your community. And the next piece it would be just to start talking to other nurses that do that. And my personal preference, it would be to tell a nurse, become involved in an association like AAMC and network with those other nurses that are doing that role that you're looking at moving into. And I think nurses are given a certain skill when we're being educated to become nurses, but there are pieces of that you need to expand upon in order to go into more of a managed care office or case management type role. So I think anything that you can do for yourself to increase your knowledge base on an office environment or the difference between working in a hospital and actually doing a full-time medical review or case management role.
Yeah, good. That's great advice. I want you to think about all the different fields in managed care that nurses can be involved with. I know you're very involved with medical review, but there's utilization review, care coordination, case management, so on and so forth. What are some of the managed care fields like that that you see today as having expanding opportunities for nurses to get involved with?
Care coordination in the hospital has been increasing throughout the last probably 5 to 6 years, which is a form of utilization review or utilization management within the hospital. So it's taking the piece of, it's case managing that patient in the hospital to make sure he's getting the service they need and that they're prepared to go home, that they're getting their services covered so that the doctors, the nurses, all the ancillary services are being handled the way they need to be handled in order to get appropriate payment. So that would be one really big area that has really expanded greatly as far as managed care over the last 5 to 8 years, I would say. Utilization management and utilization review is still, we kind of lump that and medical review all together these days. All of those are still very alive and being used. They may not call them all the same buzzwords as they used to, but both the commercial and the federal entitlement programs all still use some component of utilization review, which is a criteria-based review of either live records or post-payment type records. So again, it's kind of the same thing as care coordination is in the hospital, only it's probably a little less involvement with the patients and a little more involvement with paperwork. The whole quality aspect of a care coordination unit in a hospital, or the whole quality aspect of a medical review or utilization management department in a plan is also another area that a nurse could really expand on. Quality is exceedingly important, and it always has been. But I do see a slight trend that quality is becoming more and more important, especially in the federally mandated programs.
Mm-hmm.
You know, making sure that everybody's consistent in what they're doing, and that each nurse is handling the cases the same.
What about the area of nursing informatics? We seem to be getting a lot of questions from our clients looking for people with that kind of experience. Do you see that as an expanding field for managed care nurses?
I think it's been an expanding field for quite some time with electronic health records and each of those electronic health records come into fruition into offices, the nurses really understanding what that is and how that impacts them. I've actually had some experience in the informatics portion of it. I think that it is expanding more so in the last 2 years than previously, but I think a lot of that's because of the mandates to make sure that everyone goes into those. Mm-hmm. But beyond the electronic health records, there's so many other things that a nurse with that kind of a knowledge base, the more they understand about the informatics, the more they can actually impact how those things are utilized and how they're created.
What kind of opportunities do you think managed care nurses might have in the upcoming health insurance exchanges?
That's a good question. I hadn't thought of that one before. I think they could, because I think there'll have to be an explanation. The one thing about anytime you use anything with IT type background, mm-hmm. there is the different languages that need to be explained. So if I'm an IT professional, I speak in a certain language, and if I'm a nurse, I speak in a different language. And I think you need that combination of both of those in order mm-hmm. to make a good product and to be able to explain that product to other healthcare professionals.
What kind of resources would you say the MCN has with respect to helping nurses get prepared for some of these expanding fields?
Our educational committee, I think, probably is one of the best bets on that. It definitely has a lot of nurses that work in a lot of different fields that sit on that committee that try to come up with the educational pieces that are needed to help nurses expand their role. Mm-hmm. I also think the networking within AAMCN would fundamentally help any nurse that was trying to go into any different area of nursing mm-hmm. that touches managed care, and I think informatics would go right along with that. I know that we have several nurses that work in informatics that assist in that educational development. So mm-hmm. I think in the future we'll see some CEUs come out of that mm-hmm. and address opportunities.
You mentioned networking several times as one of the benefits of being a part of the association. Certainly, if there's any managed care nurses listening that are not involved, I know they have a group on LinkedIn, and that's a great place to go. And there's of course, no cost involved in that or anything. And if any of the nurses listening are not on LinkedIn, they can certainly send me an invite. I'd be happy to accept that, and you can get connected to a lot of other nurses that way. And also, I would encourage anybody who is on LinkedIn to get involved in that group as well. So I know that's one of the advantages.
It is. And we also have, there's actually a Facebook page for AAMCN also. And we have our own, once you're a member of the association, we have our own networking similar to LinkedIn that mm-hmm. As a member you have access to that allows you to go in and you can start a discussion similar to what they do in LinkedIn and with mm-hmm. other nurses that are in the association.
Great. All right, well, this is our lightning round segment, the part in our show where we get a quick, high-level perspective from our guest on some of the most pressing questions in their field. And we're not looking for detailed answers to these questions. We simply want a 1 minute or less perspective from you on each one of these. So let's start with the question number one. There are 4 questions. Lanita, what would you say is the number one priority for managed care nurses today?
To learn everything they can in regards to what they're supporting, whatever division they're working in order to help the patient.
Question number 2, what do we need to do more of in managed care nursing?
I think we need to work together more. We need to coordinate the care between ourselves first before we even worried about coordinating with other departments.
All right. Question number 3, what do we need to stop doing in managed care nursing?
I think like any other no matter what you're doing, I think we have to stop blaming others for anything that we're finding and really take responsibility to make things better.
Okay. And last question, the best singing competition, American Idol or The Voice?
The Voice.
That's what everybody chooses. Great. Any final thoughts before we finish today?
The only thing I just would like to thank you again so much. It was a huge honor for me to receive that award, and I want to thank you and Medicaid Matters for your involvement in that.
Well, great. I appreciate it so much, and we're glad to be able to have you on the show today. And I know that our audience will get a lot of great information from your insights and your perspective on what's going on in managed care nursing. So, again, congratulations on winning the award, and hopefully we can have you back on the show some other time.
All right. Thank you.
Well, that was Lanita Kanoki, the 2012 recipient of the Managed Care Nurse Leader of the Year Award. And we want to thank her for her time and being on the show. Actually, we recorded that yesterday because she wasn't able to be here at this time. So we wanted to talk with her about that. And we want to also thank the American Association of Managed Care Nursing for giving me the honor of attending their conference and presenting that award to Lanita. If you want to get more information about the American Association of Managed Care Nursing, you can go to aamcn.org. That's their website. Lots of educational information there, but certainly information on how to get involved. I know Lanita also gave some information in our talk as well. So if you're in managed care nursing, or if you have nurses, if you're in a managed care organization, you have nurses that work for you, I strongly encourage you to check out AAMCN if you haven't already done so and be a part of their organization. Well, it's time for another short break. We're going to take just a quick time out here. When we come back, I'm going to talk about some of the things that are going on with accountable care organizations. And this would be a great time to call. If you're involved with accountable care organizations, why don't you give us a call? We'd like to hear from you. And I want to ask you this question. What is the main challenge that ACOs need to overcome today? What is the main challenge ACOs need to overcome today? 626-657-2125. That's the number to call. Hope we hear from you, and we'll get you on the air and talk about that. Hear from you soon.
Medicaid Matters is now booking guests. Who are we looking for? We're looking for people who can bring a fresh and unique perspective to the business of Medicaid health care. Do you have an idea that is unique, innovative, maybe even controversial? We want to hear from you. Go to MedicaidTalk.com, complete our guest questionnaire, and we'll be in touch with you to schedule an upcoming episode. Be a part of Medicaid Talk.
The Medicaid landscape is changing fast, and that means challenges, but it also means opportunity. Opportunity for you. And that's why you need to visit MedicaidJobs.net. MedicaidJobs.net is the place to showcase your talent to Medicaid companies, search for jobs, research the latest career trends, and register for the free Career Optimizer service. Don't wait. Go to MedicaidJobs.net today.
You're listening to Medicaid Matters on the blogtalkradio.com network.
Well, what would it mean to your business, to your organization, if you could tell your message, if you could bring your story to 70,000 Medicaid professionals? Well, that's what would have happened if you had been a sponsor of the Medicaid Matters show. Each week, more than 1,000 people listen to this show, and you could be telling your message to each and every one of them. There are several options to sponsor and be a part of the Medicaid Talk community in this show. Just give us a call at 866-371-0687, extension 807. Again, 866-371-0687, extension 807. Or you can email us at info@medicaidservices.net for more information. We hope you can join us and be a part of the Medicaid Talk community. If you one thing before we jump into our ACO discussion here at the latter part of the show, I wanted to reach out and talk to anyone that might be a Medicaid or a Medicare medical director, and if you have any experience in health informatics, I would really like to speak with you as soon as possible. There's a growing healthcare plan, very innovative in their approach to informatics as a care improvement tool. They're looking for a medical director that would like to join them and lead their efforts in this direction. I was particularly impressed when I spent some time with the chief medical officer of the plan about how they're collaborating with their physician providers to help them understand the full extent of the quality data, to implement changes that data was suggesting, and how to use that to improve outcomes for their individual patients. And they're not just looking for someone to manage their EMR projects. I mean, that's part of it, but they're really looking for someone. It's a very tech-savvy physician executive to lead their informatics team and their initiatives in that area. This is truly a enterprise-wide effort. My firm has been involved in many medical director searches over the past year, but few have been as unique as this role. So if you have any interest, or if you know of someone who has some interest, let me know. If you'd like to hear more about this, you can contact me at 866-371-0687, and just tell whoever answers that you want to talk to me about the medical director position that you heard about on the radio show, and we'll certainly get you filled in and connected to that. So medical director with strong informatics experience, very unique opportunity for someone like that. All right, well, let's talk about ACOs, and I'm really hoping my voice makes it through the rest of the show here. I apologize. It's pretty rough right now, but I guess as they say, the show must go on. Let me start by talking about and explaining because I know the ACO, Accountable Care Organization, is a term that is being used a lot in healthcare today. It's certainly used a lot in connection with the Affordable Care Act and the initiatives that are coming out. It's been primarily focused on Medicare, but as I'm going to mention to you here in just a moment, it is starting to move out of the Medicare realm, already has moved out of the Medicare realm, and I'm hearing more people talk about the applications of accountable care organizations in Medicaid. And again, if you're involved in this in any way and have some thoughts about this, would love to have you share them on the air here with us during our show. You can just call us at 626-657-2125, and we'd like to hear that. But here's kind of a basic definition of what an ACO is, just for those of you who may not be real clear on this. ACOs link medical care providers together to improve quality. If the providers in the ACO achieve better outcomes, then they divvy up money saved with the health plans. A health plan contracts with doctors and hospitals through an ACO, which pushes high quality, less expensive treatment rather than today's payment system, which often leads to excessive treatment by paying for each procedure that isn't always necessarily better. The providers in an ACO are responsible for managing the care of health plan enrollees and are financially rewarded if enrollees or patients stay out of a more expensive hospital. So that's that's very, very basic, very simple definition of what the ACO is. Let me read you what CMS says an ACO is, and then you're going to begin to see why there's a lot of talk about this, why there's a lot of even, let me say, perhaps ambiguity in the marketplace. This is what CMS says. Excuse me. An ACO refers to a large group of providers and suppliers of services, such as hospitals, physicians, and others involved in patient care, that will work together to coordinate care for the Medicare fee-for-service patients they serve. The goal of an ACO is to deliver seamless, high-quality care for Medicare beneficiaries instead of the fragmented care that often results from a fee-for-service payment system in which different providers receive different disconnected payments. The ACO will be a patient-centered organization where the patient and the providers are true partners in care decisions. The ACO will be responsible for maintaining a patient-centered focus and developing processes to promote evidence-based medicine, promote patient engagement, internally report on quality and cost, and coordinate care. And that is straight from the CMS guidelines and how they describe it. Well, there was big news about ACOs this week that appeared actually yesterday in Forbes magazine. I have a copy of it here if you haven't seen that. It's actually on their website from Bruce Jasper at Forbes. And it talks about how Obamacare's, that was their term, accountable care approach reaches 1 in 10, roughly 10% of the U.S. population right now is being served by ACOs, according to a new report. This report, which comes from the consulting firm Oliver Wyman, which was released on Monday, says the growth of accountable care organizations, or ACOs, has reached up to 25 to 31 million patients, growing beyond the 2.4 million patients in the government's voluntary program for seniors covered by Medicare health insurance program for the elderly patients in private and employer-sponsored health plans. Now, anytime 25 to 31 million people get involved in something, you know that's going to create news. You know that's going to create momentum. In fact, in this report, some of this momentum is being called a tsunami of ACO movement. I don't know if we're ready or if I'm ready to make that call right now, but certainly there is a lot of momentum. And with this number of people, it is going to get the attention of many organizations, as we can see. You know, ACOs began just contracting with Medicare programs just this past spring, but now many of the large private insurers are jumping into it, including Aetna, United Health, Humana, Cigna, and most Blue Cross plans are starting to link with ACOs to care for more patients. And I think that's an important thing to note. Whenever you see private industry like that moving forward, moving on something in this way, you know that it's going to be important. And I believe there are a lot of implications and a lot of opportunity for Medicaid organizations to be involved with this as well. The Wyman report is beginning to confirm the predictions that ACOs will take off in the private sector as well. They report that more than 500 organizations have applied for just the Medicare Shared Savings Program that's expected to begin in January of 2013. We anticipate, says the report, not just more new participants, but far more patients per organization as many larger health systems, which have been slower to apply, finally join in. So we're seeing here I guess we would say a faster than anticipated expansion in ACOs by organizations that have been involved with this. And it's something that we're going to have to get our arms around, certainly something that I think we're hearing from our clients. More of them are getting involved with the ACOs, particularly in the care management portion of it, of ACOs, and it's something that is going to have to be dealt with as we move forward. We're going to have to, I'm getting word here, we need to stop to take our last break before we get into the rest of this. If you've been waiting to join the conversation, you have a thought, or some expertise or an opinion about this expansion in ACOs, we'd love to hear from you now. We'll be back in just a moment, and stay with us, and we're going to finish up our discussion about ACOs.
I hope you're enjoying today's show, and I want to remind you that opinions and viewpoints expressed by guests on the Medicaid Matters Talk Show are not necessarily those of the host or our sponsors. Thanks for listening, and we'll be back in just a moment.
Every 19 seconds, a child will die because of a lack of clean water. It is estimated that more than 80% of childhood diseases and deaths in underdeveloped countries are a direct result of drinking contaminated water. During the course of this commercial, 3 children will die. You can help make a difference in the lives of these children. By supporting Healing Hands International, you will provide safe, clean drinking water to families and villages around the world. Since 2006, Healing Hands has drilled more than 400 water wells in countries like Haiti, Ethiopia, Zimbabwe, and Honduras. Through the help of people like you, we have been able to bring the gift of clean water to more than 1 million people. To learn more about Healing Hands International and what we are doing to help, visit www.hhi.org. With your help, we can continue this life-saving work and make a significant difference in the lives of children.
Well, this is Medicaid Matters, the only live talk show about the business of Medicaid healthcare. We're here every Tuesday, 1 p.m. Eastern Time. We hope that you make plans to join us each and every show. If you can't, for whatever reason, you can always catch a podcast version of the show on iTunes. I would encourage you to, if that's something that you like to do, to go and search out Medicaid Matters and subscribe to that, and it'll always be downloaded to your mobile device or whatever device you use to listen to that. I was asked a couple of weeks ago what it was about the Healing Hands International, why we support that organization, and it was kind of more of a personal interest of mine. I happened to see a video last year about some of the work that they do, and I was struck by 2 things. One is the impact that they have in one of the projects that they're involved with, which is drilling water wells in underdeveloped countries. And for a relatively small amount of money, I think it's something around $3,000, a well can be built and dug that will provide clean, safe drinking water to almost 4,000 people. But what also struck me was just how much I took for granted that I have clean, safe water. Didn't realize there were people that had to send their children out to walk 10, 20 miles a day just to find something as basic as water. So we're a supporter of that organization. We hope that that you will join us as well. If you're at the MedicaidTalk.com page, you'll see a icon there for them. You can click on that and make a contribution. And I certainly hope you will, particularly as we enter this period of the year when we're the season of giving, as it's sometimes called. Well, we're talking about ACOs here in our final subject. I thought we've spent a little time talking about what ACOs are and some of the movement, some of the momentum that is going on in ACOs right now. But I thought I would also spend some time in talking about what an ACO is not. And I think there is some confusion there, at least in some of the conversations I've had with people. And I want to read from the Health Affairs blog, an article that Ron Clark published there in August of last year. And when he talks about what ACOs are not, what he talks about is that it's not the same old 1990s managed care by HMOs or health plans, just kind of changing the word from HMO to ACO. It's also not prospective funding, either capitation on a population basis or bundling on an episode basis. It does not involve member enrollment. It does not require the use of an exclusive panel of providers, and it does not include differential patient cost sharing or benefits. What it is, it's the retention of freedoms of traditional coverage with the added discipline of proactive patient-specific care enhancements. And here's what I think is important to note. The focus is on the patient's care plan. That's the main focus in the ACO. And that is something that we're hearing over and over again, talking about how to reduce costs in Medicaid, which is to focus on the quality of care and the outcome that the person is getting from a long-term perspective. Again, that patient-centered focused care, as opposed to paying for treatments to handle illnesses and ailments and injuries or whatever they might be, chronic conditions or acute, that come up as they're being asked for. Clark goes on to write, is the anticipation of each patient's needs and to deal with these needs in a planned, coordinated, and seamless fashion. It is taking responsibility for their care processes and being accountable for their care outcomes. Again, focus on patient's care. And that is, and you might also say that in a not so much a tangent, but in as part of that focus on the patient's care, the Accountable Care Organization is also providing a sometimes missing ingredient, and that is the focus on performance, on having care that actually creates a better outcome. This was stated in the preamble of the Medicare Shared Savings Statute, and that is to promote accountability, to work together to manage and coordinate care, to encourage investment in infrastructure and redesigned care processes for a high quality and efficient delivery service. This all sounds great in theory, I know, because the theory is that by moving into an ACO, and that with these changes, most organizations of providers are going to be able to achieve meaningful reductions in things like hospital days, things like reduced admissions, lengths of stay, rehospitalizations, reductions in complications and adverse events, reductions in the use of higher cost items, redundant testing, or marginally useful or unknowingly duplicated services. Clark goes on to talk about 7 different ingredients, 7 different capabilities that have to be in place in order for an accountable care organization to flourish, for an accountable care organization to be successful. He calls these the 7 C's. They're change, capacity, commitment, collaboration, communication, coordination, and capital. I'm going to talk about just a few of these because I thought it was kind of interesting in how he characterized these. First of all, I'm going to talk about capacity, and he segments capacity into 3 different categories: clinical, administrative, and systems. Clinical, is not only the sufficient number of primary care practitioners, but also having a range of practitioners that can manage the care and handle the care that a person would have. Second is administrative, and it's not just dedicated staff to move some paper around, but also people that can bridge the gap between patients and practitioners to facilitate that care process. A dedicated administrative staff that can also analyze the data to support patient and provider monitoring, measurement, and reporting. And then the third element would be systems, and is I think going to be extraordinarily difficult for ACOs to succeed without having a very robust technology system to support that. Now, I've been at several conferences over the past 6 months where this has come up, and this kind of leads me to the next one of the 7 C's I want to talk about, is the expense in launching an ACO. And he does talk about this, that there is a need for capital, fund capital, for the implementation of the ACO, for the implementation of the systems. which is can be very costly, but absolutely necessary. In fact, I heard a presenter just a few months ago at a conference talking about ACOs that said that the startup costs and the administrative costs that they're seeing in their organization almost eclipses the savings that they anticipate they will get from the ACO, at least in the short term. So these appear to be long-term prospects and long-term projects that we're going to have to be implemented and monitored as we go along. So capital, capacity, excuse me, and the other area of his 7 C's that I wanted to mention that I thought was interesting, because I'm hearing a lot of conversation about this as well, and that's collaboration. And that's collaboration it's collaboration among all of the practitioners, all the providers in the accountable care organizations. You know, in physicians, even those within a group practice, they tend to be very independent and somewhat isolated from one another. And I don't think that that's necessarily by design. It's just the way the business works and how they get involved in that. And the collaboration has to be such that each patient in the ACO is no longer my patient, but it is our patient. It is the patient of the ACO, and that perspective must be maintained where you're looking at the whole patient. So that has to be prevalent in the ACO for that to be successful. So, you know, this sounds great. The theory is great. We're hearing about a lot of momentum moving in that direction. What are some of the obstacles? What are some of the things that we're hearing about? It sounds good, momentum, there's hype, but what we're seeing and what I've been reading is that most doctors are really not that excited about ACOs. In fact, there was a survey that was released back in September from the Physicians Foundation that said that less than 10% of physicians believe that ACOs are likely to enhance the quality and decrease the cost of the care that they provide. So few physicians right now actually believe that accountable care organizations are going to live up to what they're being portrayed as doing. And the survey, that was a survey of 13,500 physicians across the country. So if we're seeing a lot of momentum, we're hearing though from physicians that they don't think it's really going to pan out. What do we do? How can their perception be changed if we're going to realize the true value of the ACOs? Well, according to that same survey, according to Michael Detchen, who's a Senior Vice President of Service Offerings for Arcadia Solutions, which is a Arcadia Solutions, a healthcare consulting firm. He says it's going to take communication. He said executives in the ACO, executive in the provider organizations that are sponsoring ACOs are going to have to get on board and are going to have to begin to communicate with physicians, and they need to invest the time in that strategy. The first thing hospital executives should emphasize is that becoming an ACO and providing coordinated care is going to be better for patients, and then executives are going to have to express that to physicians and help them understand how this is all going to work. So maybe the physicians in this survey haven't had the benefit of that type of
90 seconds,
and they don't know just how it might work for them. Well, we are just about out of time for today's installment. There's many more things that I think we could talk about on ACOs. And again, I want to reach out to our audience, our listening and viewing audience. If you have expertise in ACOs, you want to come on the show and talk to us about how you think the interaction with ACOs and Medicaid could be beneficial, I would really like to talk with you.
60 seconds.
If you've missed anything on today's show or any other show, you can go to MedicaidTalk.com to watch a replay. You can also subscribe to a podcast version on iTunes. So take a moment now. If you're on our website, leave us a comment. We do read those. They're very beneficial. They're all read. They're very helpful. Well, we're going to be back in 2 weeks with another great show. Let us know if there's any topics you'd like to see us cover in 2013. We want to do that. And don't forget, join our list. Get that code for $200 discount off the Medicaid Innovations Conference in February. You know you're going to need a trip to Florida in February, so why not get registered today, and I'll see you there. You've been listening to Medicaid Matters, where it's brought to you by the MMS Group. Today is Tuesday, November 27th, and I'm Richard Yaden. I'll be talking to you again in 2 weeks. Have a great day.